I want to talk to you today about something that I learned about 25 years ago. And it really changed my life when I learned about it. It's something that it seems most therapists don't know about, or they don't understand how important it is to understand this aspect of this. So it's something I call internalized blame of self, or IBS, emotional IBS. And I'll tell you why I call it that in a little bit here. So when a child is being abused or neglected or just being affected by parents and adults' decisions, that child has no other resource for defense than their undeveloped brain. So little kids have something called egocentric thinking. They think they caused everything in their world to happen. This is natural. Their worlds are pretty small. Kids say cute things like it's raining because I'm sad because they don't understand science. So when we're a kid and we go through things, we have to get through them. And all humans need a sense of psychological control, even children. And so even an illusion of control will help a child survive. So here's the illustration I usually use for this. So little Tommy or Mary is 4 or 5 years old, and here's their parents fighting every night, and daddy yells at mommy, "Why is the room so messy? You're home with him or her all day. Why is the room messy?" And so one day she comes home from kindergarten or preschool and learns that daddy's not going to live with her and mom anymore. So what does she think? Nobody gets this wrong. She thinks it's because my room is messy. And now she goes into her room, looks around, she thinks, maybe if I clean my room up good enough, daddy will come back. What does this tell us? She thinks she's in control of the situation. Of course she's not. The adults are having adult problems. I used a clip from the movie Mrs. Doubtfire to illustrate this. In the beginning of the movie, some things have happened around the 12-year-old boy's birthday, and mom says she wants a divorce. And the next day, and they even sit the kids down and say, "This isn't your fault." And the next day, as dad is moving out, the 12-year-old follows him and says, "Dad, it's all my fault. I shouldn't have had a birthday." So that's not a movie about abuse, but it shows that this is a common defense that we have, especially as children. Now, this gets us through our childhood because if somebody is, for instance, hitting us and the child could figure out it was the parent and not them, what do you think is going to happen when the child stands up and says, "Dad, you need to go to therapy"? They're probably going to get hit more. And so it could actually be physically saving a child's life, and it certainly does save us psychologically. The problem is then we grow up with this not good enough syndrome. And adults become either sometimes very high overachievers. I worked with clients who are working on their third master's degree so they could get their dad's attention, the one that hurt them. Or they're very much underachievers. They self-sabotage. They get involved in addiction and bad relationships. They get into car crashes a lot. Things happen in their lives to them that seem to reinforce what they believe about themselves, that they don't deserve a good life and that they're not good enough. So I think it's so important for anybody who's going to be guiding or helping with therapy or coaching support. I think it's so important to understand this concept and to teach people about this defense developed in childhood. It was a good defense in childhood, and in adulthood it's not helpful at all. We get stuck in this. And it's kind of a hard thing for people to look at sometimes. When I first was teaching my clients about this after my training with Dr. Ross, I did not want to use that term locus of control shift. It didn't explain this very well to me. So I told clients to just notice for a week between sessions, to just notice how often they put themselves down, how often they call themselves a name like idiot, loser, fat, ugly, whatever it happens to be, and how often they have thoughts that they really don't deserve good things in life. And this manifests in lots of different ways. So I just asked them to notice those things, not to do anything else with them. And they would come back really mad at me. And I was trying to figure out, what am I going to call this? I don't want to use that other term. And so one client said to me, "It's a lot of crap to deal with." And I went, aha, I'm going to call it emotional IBS, internalized blame of self. Again, this equates to shame, feeling not good enough, imposter syndrome, all those ways we put ourselves down. So if we can understand that this is a defense, understanding it doesn't make it go away. In the next video, I'm going to give you some tips on how to help people recover from this. But I want you to understand that not very many people know how to use this explanation in a therapeutic way. All us therapists, we know how to go, oh, poor you, it's not your fault, it's not your fault. Well, my thing is, why do I think it's my fault in the first place? I used to go to Al-Anon because I grew up with some alcoholism. And there they say the three C's. I didn't cause it, I can't control it, I can't cure it. My question is, why do I think those things in the first place? Well, this is the reason. Number one, my brain's not developed. I can't figure it out. I'm centered on myself, so I take responsibility. And that gives me an illusion of control and helps me survive childhood. So next time, like I said, I'm going to give you some tips on how to help people recover from this. But I hope this information is helpful, both in your personal and your professional work.